Hello everyone, dear friends. We welcome you on this warm spring day. Liza has arrived. What is bothering her and what does she want from us? Let her tell us herself. Liza,
And I have hyperlordosis and pain along my spine.
thank you for the information. Now we will proceed to the examination. Next, a warming massage and manual therapy. Let's get started. So what now? Well, first of all, I need to see as well, not just the viewers. Come over here. Me? No, you stay there. Everyone stays in place. Only the cameraman moves. I truly think right here, right now, you're filming well. Is there discomfort here? Yes. Cameraman, could you please step aside for just a moment? It's becoming quite ticklish right here, you see, and I need a little more space. We have a normal asymmetry. It hurts here, it's ticklish here. Relax, take a breath in and out. Excellent. You can lower your shoulders too. Wait, the first option.
Well,
In general, you can see that if the cameraman, let's turn around, our cameraman is a bit unusual. You can see that our shoulders are turned toward the chest inward, so we need to open them up. Right, Lisa? You're familiar with this? Relax. The rhomboids need to be strengthened. They're so weak that you could hide something here. Relaxed. Let's turn around. Lumbar hyperlordosis, which Liza herself actually mentioned to us. Is that right, Liza? Excellent. Good. We'll check everything else while lying down now. So let's move to a horizontal position. Lie down, Liza. Liza, you'll need to take off Lesha's vest.
vest?
Yes.
Will the coach come back?
That's exactly why he's taking it off. Ah,
That's why he's taking it off.
don't judge me just because I work as a taxi driver. I have my own business. Now we're going to do, well, we haven't shown this before. You'll be the first one on video, Liza. We'll do a vacuum massage. By the way, it's useful. You can buy the same kind of cup, a cup, and use it to pickle cucumbers. Of course not. You can buy the same kind of cup. Should we leave a link in the description? Of course we won't. We don't do that. And do a vacuum massage. What is it for? Wherever there's a problem, a trigger point. Yes, right in these spots. Liza, say something. No. But you can feel the trigger point. Wherever there's a problem, that's where a bruise will appear. You shouldn't be afraid of bruises. They go away. That's just what they do. Later on, when the bruise starts to fade, you can repeat the procedure and eventually you won't get bruises anymore. Unless you have weak capillaries or blood vessels in general. Liza, this is oil.
A brief advertisement.
Has started. The cameraman doesn't like this. Did you also imagine how you could fry pancakes with it?
Well, then, I suppose so it is, then, indeed.
Actually, it's edible coconut oil. The prominent pair of paravertebral muscles. Exactly which specific ones are we actively lifting and engaging? Actually, there's even a shockwave therapy device, SWT. You cannot really compare them, but still, if you can truly and effectively work with it, it is indeed pretty good. Even if there is some noticeable pain here, it is actually quite pleasant. It's a unique experience. The SWT is a medical device. That's the first and most important difference. The second is that SWT has the ability to penetrate, so if I need to reach a deep muscle, it will get to it right away. Elizaveta Andreevna, are you ready? Then we will definitely need your facial features and characteristics to proceed with the identification process. Turn your head to the side. Do you find yourself liking one option better than the other? When a patient specifically asks you, the medical professional, which particular one they should choose, you can simply and reassuringly respond by saying whichever option you personally prefer or feel most comfortable with. They start turning back and forth. It's kind of like when you arrive at the parking lot, there are tons of spots and you start getting confused. Our operator is lying down. He's having a good day today. He's happy. It's warm. Liza, let's go. All right, then let's definitely do this particular one as well. This is so you don't get too relaxed, Liza. Relax completely. Just take a deep breath. That's exactly it. I use clean napkins carefully so there's no any slipping and to prevent excess after the oil. Sometimes it gets slippery. If anything at all, we'll bleep it out if necessary. Let's continue. Well, now she's tense. She needs to relax. Let's go. Yes. Liza, do you have a cat at home?
I do.
Well, you absolutely need to take some time to truly relax and unwind. Instead of the usual familiar clicks, we now hear absolutely nothing at all. Are you ready to discover what that means? You're not. And now, let's go. Relax. Let's do it like this. Okay, gently move your shoulders just a little bit now. Back. Let's stretch a bit. Relax. It clicks a little, but damn, it interrupts. Damn, to put it mildly. But hey, you see, they made you a little bruise. 1 star. Too soon, too soon, too soon. There, now you can. Liza, could you please carefully put on your protective body armor and then gently, very slowly turn onto your right side? I was actually quite genuinely worried about my own back too, at that particular moment. I went to different specialists. Well, many of them, were not truly performing their duties or achieving the expected outcomes as they rightfully should have been. I'm not saying that manual physical therapy, a hands-on approach, well, how can I express this in a more delicate and considerate manner, did not provide any significant or lasting benefit whatsoever, but somehow I personally sought out and visited a manual therapist for treatment. Please bend your lower arm right here in this specific manner, just like this example. Closer to me.
The pelvis area.
Move your pelvis. All right, now gently bend and then slowly straighten your entire lower leg, allowing for a full range of motion. And straighten it. Just a bit this way so there's no arch in your back. Bend your arm under your head. And honestly, with our lifestyle these days, with the way we live, everyone needs this, myself included. Turn your torso. Lie on your back. But hey, it's something new in your life, see?
Absolutely.
Cross your arms, place your right hand on your left shoulder and your left hand on your right shoulder. So everything is the opposite.
Let's do it then. Right now.
Like this. What are you doing over there? Gathering vodka, drinking, exhaling.
That's just it.
Relax. Oh, the microphone just said something truly, truly awful and inappropriate. Please turn onto your side now. To the left. And sit up. No. Swing your leg over. Clasp your hands behind your head. Behind the neck or the head? Behind the head. What is the fundamental nature of this, bunny? Alright, I see I need to be quick with you. Okay, now stand on our mat. This is Aladdin's carpet. Wait, what are you doing with our swaddle? It's obvious the blood is already flowing. Alright, we'll deal with that later. Clasp your hands behind your back. Back to me. I understand that the viewers are very important.
A fiery episode. Yes?
Alright? Head down. Lower yourself through the lock so there's some pressure. It's really not that incredibly difficult, is it? As it ultimately turned out to be, in the end it truly wasn't. Liza, the floor is yours.
Thank you.
Where are you going? We're not done yet. Trying to run away before the contest? 100%. Are you filming the whole video? The most important thing for us is the tenderloin area. Sit here. Always keep your back upright. Ikotep, come over here. Our scissors won't stay sharp with all this cutting. Maintain a perfectly straight back position. Alright, stop crying. Tilt your head. Look what I found.
So,
Now let us carefully examine and consider the opposing perspective. Turning back, we now consider even. Wait. Lie on your stomach. The necks will be there now. Head on chin. Arms along the body. We have a head, we have a chin. This is called the forehead. All in this format. You don't even know what I want to do. Tilt your head here. Relax, relax. Because the patient is already waiting for us there and can hear all of this. Relax more. Good. Now gently turn onto your back. Your subsequent station is dedicated to complete decompression. So interesting when it's not a Russian saying it. Relaxed.
wait. My earring is really quite poking me right now. Do you actually want to know what I mean by that, perhaps?
Me to take off?
I don't want to. Alright then.
Let's go. The overall really quite significant traction was really quite good indeed.
What exactly did you genuinely feel in that particular moment?
I
I felt all my vertebrae crack at once. It was truly quite frightening, but at this moment right now, I don't know exactly what it is. But the decompression indeed occurred. It truly...
She decided to lie down like this herself. I honestly don't know where she truly wants to run off to all the time, every single moment. Now let's gracefully move on to the legs. Please completely relax your legs, both of them. You really need to relax, just relax them completely. Let go completely of it all now and just everything. Of the leg, we need to thoroughly check the hip joint and also the other leg. Good. Now turn over onto your stomach, onto your elbows. Get up on your elbows, making sure they are perfectly straight and aligned. Keep your elbows together nice and tight, maintaining that position. Now slowly and deliberately lean your body forward. Look. Relax, relax, relax. Breathe. Good. Please get up. Stand on our mat. How many times do I have to repeat myself? Our mat. Give me your hand to the side. Stand up.
Stand on your feet now, please.
Sideways. Everything's fine. That's it. Completely relax your arm now. And then just the other one, please. Take your time with it. The truly magnificent indeed.
Same with the diagnosis. So,
Liz, we're basically done. Yeah, we were basically. No one saw the mic. Did you sit on it or something? If there are any strange or unusual noises, you know it's because the cameraman accidentally sat on our sensitive microphone. Come on, Liz, please put it in the very special and designated place for the microphone. That truly wasn't easy at all.
I agree.
But we're supposedly done. Liz, if you would please share with our viewers, for everyone watching at home, what happened, how it went, and where it was. It was
Weird. It was utterly and truly scary. Are you genuinely scared that your very own vertebrae are indeed about to crack? No, not at all.
It's not the vertebrae that crack, just so you know.
It's the intervertebral discs. What cracks then?
Well, it's the capsules.
The capsules crack? It's really scary when the capsules crack. But what do we feel afterwards? The care of a specialist.
I feel recharged with energy. Do you feel lighter?
You feel lightness in your arms, in your legs, in your spine.
Can you walk across our carpet with a shining, brilliant light?
Step
Yeah. And
to the hip. And the
basically call in the next patient, let her walk.
thank you.
So that's basically all it is, really.
Tears are flowing, that's cool. Yeah.
Well, we'll stretch and loosen up everything else. There's no need to show that anymore. You've already seen that in our videos. This is Liza, this is me. My name is Zakar. This is the cameraman. He gets called something different every day. Thank you all for watching. Leave a like or a dislike. Subscribe or unsubscribe. Leave your comments. Liza, me, goodbye everyone. Book an appointment.
With just the Zakar.
Thank you. Goodbye everyone. See you next time.